Hi, I'm Dr. Ruchi Gupta. I'm an associate professor of pediatrics at Lurie Children's Hospital in Northwestern Medicine in Chicago. I'm going to talk to you today about food allergy epidemiology in the U.S. and also the recent new early introduction guidelines. So in the U.S., food allergy impacts 8% of U.S. children. That's about 1 in 13 children, or about 2 in every classroom. Now, the top food allergens in the U.S. include peanut, followed by milk, shellfish, tree nut, egg, finfish, wheat, and soy. All of the foods can cause severe anaphylactic reactions. Peanut and tree nut seem to be the highest in that, followed by shellfish. Now, the economic impact in the U.S. of food allergy is quite large. We conducted a study finding that it costs about $24.8 billion a year in the U.S., which is about $4,000 per food allergic child per year. Now, recently, a landmark study came out in 2015 in the New England Journal of Medicine called Randomized Trial of Peanut Consumption in Infants at Risk for Peanut Allergy. Now, this study found that in high-risk children, if you introduce peanut products early, so between 4 and 11 months, it significantly reduced the development of peanut allergy by 80%. Now, this caused the NIAID in the U.S. to develop guidelines for the introduction of peanut products in infants. Now, these guidelines stated that if an infant is at high risk, so high risk means severe eczema or a history of egg allergy, they should receive testing, which we'll discuss, at around 4 to 6 months of age, because these are the kids that are most prone to developing a food allergy. Now, if they're at low risk, and low risk meaning mild to moderate eczema or no eczema at all, you should encourage these infants to go ahead and introduce peanut products. So families can introduce it around 6 months or however desired, depending on their cultural practices. Now again, if they have severe eczema, let's talk about that now. So severe eczema or a history of egg allergy, that puts them at high risk. And if they do fall into this category, it is recommended to get them tested. Now, you can test them in 2 ways. You can get a peanut-specific IgE, and if this is less than 0.35, they can go ahead and introduce peanuts. Now, if it's greater than 0.35, then they need to see an allergist for skin prick testing. The other option is for them to just see an allergist for skin prick testing. Now, the skin prick testing results, if they are 0 to 2, they can have an in-office feeding with their allergist or just begin peanut products. If the skin prick test is 3 to 7 millimeters, they need to have a consultation with the allergist to have a progressive food challenge to see if they can consume peanut products. Now, if the skin prick test is greater than 8 millimeters, they should be advised not to introduce peanuts into their diet, as they probably already have a peanut allergy. Now, there's some confusion in the U.S. amongst physicians because in the year 2000, the American Academy of Pediatrics released some guidelines saying not to introduce peanut products until 3 years of age. Then in 2008, they changed these guidelines, saying, do whatever feels right, because we don't know. We don't have enough data or research to make a decision on which way to go. Now, in 2015, the LEAP study, which we discussed, was published in the New England Journal of Medicine, and now in 2017, the AAP is recommending early introduction of peanut products. So it's important, if you are an allergist, to encourage the pediatricians to follow these guideline recommendations and to educate in your community about these recommendations, because we have the potential to significantly decrease peanut prevalence. Thank you.